Hello and welcome back to Curry Soup. Today we're going to be talking about leptospirosis. By the end of the video, I guarantee you'll be an expert on everything leptospirosis. How does it infect, how does it travel, and most importantly, what are you supposed to avoid doing to prevent this disease? So without wasting any more time, let's get straight into it. Leptospirosis is a bacterial infection caused by spirochetes Leptospira. In 1907, a scientist, Arthur Stimson, used a special staining method on a post-mortem examination he was doing on a patient who had leptospirosis. Under the microscope, he saw this bacteria which was spiral in shape, so he called it spirocheta. And the general structure, general shape of the bacteria looked like a question mark, so he called it Spirocheta interrogans. Leptospirosis is the most common zoonosis. That means the most common infection which is transferred from a non-human organism to a human. Let's talk about symptoms first. 90% of leptospirosis cases are usually very non-specific. That means it looks a lot like a viral fever. So they'll have fever, headache, retroorbital pain, vomiting, nausea. It looks almost like a dengue fever. But the difference is, dengue is a viral infection, so the doctor won't be giving you any medication, just supportive therapy. But here, it's a bacterial infection, and in leptospirosis especially, the earlier you start treatment, the better the prognosis is, the better the outcome is. In the other 10%, the presentation is much more dramatic. We call it the whale disease or icteric jaundice. The fatality rate for this disease is 5 to 10%, which is quite high. Here, patients come with fever, jaundice, kidney failure, signs of bleeding, and usually have other organ systems involved. For example, the respiratory system, the blood circulation system, and even the central nervous system. Inflammation of the blood vessels can cause fluid loss, which will further deteriorate the condition of the kidney, which can lead to acute kidney failure to the point where the patient might require dialysis. 30 to 50% of all leptospirosis cases are usually due to occupational hazard. People who at work has very frequent contact with animals and rodents and stuff. For example, those who work in a farm, veterinarians, pet shop owners, coal miners, those working in the fishing industry, plumbers, military troops, sewer workers. So these are all people at risk. But recently, leptospirosis has become more of a recreational disease because of activities like adventure racing, travel, sporting events which involves freshwater, hiking or mud. These are all causing more cases of leptospirosis. And not to forget floods. Places which just recently got hit by floods and everything. It's easier for the water to spread this leptospirosis bacteria to more people and faster. So how does leptospirosis spread? If you remember earlier, I did mention leptospirosis is the most common zoonosis. That means transmitted from a non-human organism to a human. This is because they spread from rodents like rats or even animals like dogs and horses. Because part of the life cycle of leptospirosis, the bacteria, is a chronic carrier state in some animals. That means they will infect the animal, they'll migrate to the kidney, they'll stay there, and they'll continue to shed this bacteria for a very long time through the animal's urine. The same thing happens in humans, but then humans are called accidental hosts because we can't keep shedding this bacteria for a long time. Usually no more than 60 days. And since I mentioned dogs earlier, it's only fair to give some of you dog lovers some closure. When I say dogs, I mean mainly domestic dogs. Those which live in areas with dairy farms or those who likes to roam a lot by itself in rural areas and drink water from unknown sources. These are the most susceptible ones. But even healthy immunized dogs have the risk of contracting leptospirosis. So dog owners in warm climates with heavy rainfall, you can always discuss with your vet whether your dog needs to be vaccinated against leptospirosis or not. Otherwise, your normal contact and normal routine care for the animal, for the dog, doesn't pose that much of a risk of contraction. For us to actually get infected with leptospirosis, we need to have direct contact with either an actively sick animal or we have to have contact with any water, soil or mud contaminated with the urine of a chronic carrier of leptospirosis. And this contact must happen either in our mucosa, that means inside our mouth if we accidentally swallowed it, or if let's say we have any skin break in our body, let's say there's a scratch in my leg and then with that scratch I go walk in the flood water or something, so I'm gonna have leptospirosis if that bacteria was present in that area. Because this bacteria can survive in fresh water for up to 16 days, and if it's in the soil, it can stay up to almost a month, like 24-25 days. So what should you do, or rather what should you not do so that you don't get leptospirosis? Number one, avoid contact with environment which potentially has been contaminated with urine or feces by rodents, especially rats. Number two, avoid swallowing or inhaling water from either a lake, river or swamp while you are swimming there. Number three, if you're swimming outdoor anyways, immediately take a shower once once you're out of the water. And if you have any cuts or abrasions on your body, treat it with topical antibacterial ointment. Number 4, avoid participating in adventure race activities if you have any cuts or abrasions in your body. And finally, wear protective clothing and shoes. And that's everything about leptospirosis. If you found this video to be valuable, if you learned anything at all from this video, the only thing I ask is for you to share this video with your friends and family members. Spread the knowledge. If you haven't subscribed to our channel yet, go ahead and smash the subscribe button right there, and please do click the bell icon because YouTube's algorithm is changing all the time and we want to make sure our videos come and reach you. And until the next informative video, in anything you do, do your best and be the best version of yourself. Bye bye.